This is my audience. There's 1, 2, 3, 4, 5 people, 5 family members. And let me show you my visual aid. This is my visual aid. There's 2 sides. And this is my speech on anorexia nervosa. Informative speech. In our culture, we're constantly bombarded with these kinds of images every day. Whether or not we know it, they shape our perception of reality. So we're told to look great and that you lose 90 pounds and you're poking fun at celebrities for all their flaws. Now, for some, we may take this with a grain of salt. But for some, this can be one of the factors that leads to a debilitating disorder called anorexia nervosa. According to the National Eating Disorders Association, anorexia nervosa is a life-threatening eating disorder characterized by self-starvation and excessive weight loss. It's important to know that 1% of women have anorexia. Now, that doesn't seem like a lot, but that's 1 in 100. So you may know someone that has anorexia nervosa in your lifetime. And about 10 to 15% of the people that have anorexia are male. So it's not just a disorder that affects females. And just to know, it has the highest mortality rate of any mental illness. About 20% of people suffering from anorexia nervosa will die prematurely from related causes related to their disorder, including suicide, organ failure, and heart failure. So today I'm going to discuss what anorexia is, some of the causes and symptoms, as well as the treatment options that are available, because there are treatment options. So what exactly is anorexia, and what are some of the warning signs? Criteria for the diagnosis, according to the National Association of Anorexia Nervosa and Associated Disorders, which is ANAD, a person must be 15% below their ideal body weight, with a refusal to maintain a normal weight. So basically dramatic weight loss, as you can see in these pictures here. The person has an intense fear of gaining weight. Even though they are emaciated and excruciatingly thin, they still view themselves as fat. Basically, they have a preoccupation with food at this point. They count all the calories, all the fat grams in their food, excessive exercising to get rid of all the calories that are taken in. They avoid situations with food as well, so they become socially isolated. Of course, there's body image issues. A person with anorexia looks in the mirror and they don't see an accurate reflection. They see themselves as fat, even though they could be dangerously thin. The other criteria is an absence of menstruation in women. So it's called amenorrhea. Basically missing 3 periods is usually the criteria for that. So while an anorexic may not think that their weight loss is any big deal, which is often the case, there are very significant health risks associated with the disorder. It's a very real disease with very serious consequences. And basically, the body at this point is in starvation mode. Since it's denied an essential nutrients that it needs to survive, it slows down all of its processes to conserve energy. You have a normally slow heart rate, blood pressure, and at this point there's a risk for heart failure. So there's also a loss of bone density as well, which can lead to osteoporosis and breakage of bones. There's muscle loss and weakness, as we can see here. There's definitely no muscle on these people. As well as fainting and fatigue. The body becomes very, very slowed down, very weak. There's hair loss and dry skin. There's also, in the later stages, a growth of downy layer of hair called lanugo. And it's basically the body's attempt to keep itself warm. So why would anyone intentionally starve themselves? What function does any of this serve? The National Eating Disorder Association maintains that this disorder is a result of behavioral, biological, psychological, and social factors, much as we've seen before. There's low self-esteem, lack of control, and depression are the main themes. Troubled personal relationships can be a factor, being teased early on in life, or even as an adult. History of physical or sexual abuse, leading to feelings of inadequacy, basically. Cultural pressures, as we see in these images here, to be thin. This is what we see all the time. And there also may be biochemical as well as genetic predisposition to the disorder, but that's still being researched by scientists. So the bottom line is that if you or anyone you know is suffering from anorexia, getting treatment early is the key. A lot of the effects of anorexia can be reversed with treatment. So in treatment options, this is from the National Alliance on Mental Illness, different types of therapy, that's key. You have psychotherapy, cognitive behavioral therapy, family therapy, all of this works together, as well as with a physician to prescribe any sort of medications that one may need. There's support groups out there as well. So basically a team of professionals can maximize recovery from this disorder. So what everyone needs to know basically about anorexia nervosa is that it is serious and it's potentially life-threatening, and it needs to be taken seriously. The fear of gaining weight is very real to the individual suffering. I mean, it's very real fear, and although they're incredibly underweight, in their mind they have not reached perfection at this point, which is sad. I want to sum it all up with a quote from a website called To Medusa, which is run by a person in the throes of the disorder, and it's basically them relating the stark reality of the disease, and it gives us a little insight into how it can be, how terrifying it can be, and in the mind of an anorexic, how it works and how hard it is to recover from this. They said, this will always be a part of you. It will never go away. Years later, it will still be with you, and you will still have those moments. Sometimes you'll pass a mirror, and you'll suddenly be 200 pounds larger. You'll panic and shake your head trying to clear the image away. Something will happen in your life. Maybe you'll lose your job. Something will happen to take away your control, and you'll try to gain it back through starving. You will never be the same. You'll see an article on someone with an eating disorder, and you'll start to cry, remembering that terrible pain, and there are no words for the mental anguish. It can never be described. It's unimaginable. You'll never feel a pain like that, another pain so filled with loathing, vulnerability, terror, rage, and desolation. Thank you so much.